Hi everyone, this is Randy Young, and welcome into another edition of Fayette FYI. We are being presented by our community supporters, the Summers Funeral Home and Great Oaks Career Campuses. We'll have our special guest right after this.
When the Summers Funeral Home opened to serve this area in 1991, one of their top promises was to each family that they serve to provide thoughtful, caring, and respectful service to those in pain from the loss of a loved one. Terry Summers, his family, and staff continue that promise 30 years later to put your family needs first with the utmost professional care that they can provide. In your time of need, remember the Summers Funeral Home, 223 West Market Street, or call 740-335-6078.
Great Oaks is for those who can imagine a car, truck, or airplane that looks and runs as good as new, or better than new, and then gain the skills to repair, replace, repaint, and more. It's for those who know that beautiful homes don't just happen, they're the result of skill and talent. It's for those who want to program complex machines to create the parts and products that make a difference. Limited space is still available for incoming high school juniors. Apply now. Go places.
And good day everyone, welcome back into our return of the Fayette FYI show. Of course, for your information, this is a program, a community service of WCHC TV. We thought we'd kick the new series of programs off talking about, of course, the hot topic that's been going on for almost a year. And that, of course, is COVID-19. So we asked Leigh Cannon from the Fayette County Public Health Department to come and be with us today. And Leigh, obviously, a lot of folks have heard about COVID and things like that, but maybe just for the average lay person like me or something, what actually is COVID-19?
So COVID-19 is a form of a coronavirus, and we have seen coronaviruses before, but COVID-19 is a new, or you might have seen the term novel in the media releases, and that just means that it's something new that has never been seen before in humans. So it's nothing that our body has immunity to. It's unlike the other coronaviruses, so that's why it became so widespread so fast.
Is that one of the reasons why it's become so deadly?
Yeah, it's highly contagious, very, very contagious. So that is why, we're always stressing about the 6 feet of social distancing and the mask wearing, because the closer you are to someone, the higher risk you have of either contracting COVID-19 or spreading it to others.
Well, it was about a year or so ago when all this started to hit. Schools got closed, sports was canceled, people who has jobs had to stay, maybe work at home, things like that. What were some of the initial things that the health department, were kind of hit with a little bit, that you guys had to meet some challenges?
Yeah, so we had several challenges. One being staffing. We are fortunate that we are a smaller county, but we have a very higher personnel number for the staff at the health department. So that led to a challenge. We had enough staff to kind of respond at first, but I wanted to keep everybody safe. So we also implemented a work from home plan, as well as a hybrid schedule, so that we were split up. So if something happened to Team A, Team B could jump in. If something happened to Team B, Team A could jump in. We wanted to make sure that we didn't have any kind of outbreak or problem within the health department staff. We also faced some challenges with funding. In the beginning, it was just a lot of planning and preparation. Our work schedule is normally 40 hours a week, and we instantly almost went to a 24/7 type of work schedule, which the staff is not used to. We did not have staff to rotate. There were basically no breaks for quite a while, so the staff burnout and the worry about everyone kind of, was at the top of my priority list. That was just a huge hurdle in the very beginning, was trying to figure out how we were going to manage the intensity of the response.
Of course, you probably got tons of questions locally, people asking about this and that, and can they do this, can they not do that, and don't want to really get into a lot of hot topic discussions or anything, but what was possibly one of the biggest questions that maybe the general public would have?
In the very beginning, it was new to us too, so fortunately or unfortunately, when the state or the governor would put out their information, we heard it the same time everyone else did. Okay. So that really created a problem with us responding to those public questions. So they would put out their 2 p.m. press release of this is what's happening today, this order is going into effect at midnight, and then our phones would immediately start ringing. And we just heard the information at the same time that the public did. So it was just making sure that we took a pause and stepped back and utilized our communication and saying, we're going to look over these orders. It was a lot of the enforcement orders were the number one questions. Like, well, if we do this, do we have to close? If we only have one person in our office, do we have to wear a mask? If we just kind of figuring out all of those rules and all of those orders to make sure that we properly communicated that to the public was probably our number one question and issue in the very beginning of all of this.
Now let's move up a couple months. You kind of got through the summer months. The fairs were held, but kind of reduced. You had a lot of issues you had to deal with that. And then the question about going back to school. What were some of the things that you had to work with the school systems so that the kids could go back, hopefully, to classes?
Yeah, I think the most important thing was for me having 2 kids in the city school system is I did want them to be in school. I felt, with the beginning of the shutdown and the virtual learning and being at home and being sheltered, they couldn't do anything. They needed that interaction. And I have always felt like school is a very safe place for our kids to learn. So it was just making sure the goal was we want to be open, right? That was our number one goal with both of our districts, including our Christian school. So we just all decided we were going to work really hard together and make sure that all of the safety protocols were followed, all of the sports orders were followed, and we just had to get everybody on board to make sure that we followed those so the kids could stay in school. And school has been a very safe place for our students. We've had very low spread in the classroom. As you know, I'm sure you've seen on our Facebook page and our website that we have had some issues with our sports teams, but that's just because that environment is, again, very hard to social distance. So the contact is much closer and the risk is much higher.
Yeah, there's some very confusing things that have come out, like guys that can wrestle, they can get in there and mix it up, but you're not allowed to shake hands afterwards
right.
and stuff like it. It's like, come on,
I never really understood the wrestling thing, but
yeah,
it worked out actually.
Yeah, and a same thing with some of the other sports too. You're not supposed to shake hands after the games and stuff, but that, like I said, that's a minor thing. In the long run, if it's to be safe for the kids, you just kind of go with it, I guess.
Sure.
Here we are now. We're in early March. It's about a year or so. Things now have started to kind of turn in the last 4 or 5 months. With the rush to get vaccines out onto the market, trying now to get them distributed to the American people. What are some of the things that you guys have had to face as far as the distribution is concerned? Is it as smooth as you want? Still in demand? What?
Well, here at the health department, we have been planning for a mass vaccination clinic. Basically, I've been there almost 17 years, and the planning all started right after 9/11. So well over 20 years, we have already been planning for this type of situation. The tricky part with COVID-19 is that you can't just line, 500 to 1,000 people up in a line in our regular modern pod design, which is a point of dispensing site. So we had to be creative and think, how can we keep everyone safe and social distance them and still provide these mass vaccinations? So in the very beginning of us receiving vaccines, it was fairly easy because we were not receiving large quantities. We were only getting 100 a week, and then that increased to 200, and then it kind of averaged out at 300. This is the first week that we have 700.
Wow.
So we're still being highly challenged, but what we did is we just took our design and our plan that we already had, and we did it by scheduling appointments instead of just walk-ins. So we strategically schedule every single appointment, and we have them spaced out. We're currently using the Mahan building at the Fayette County Fairgrounds, so thank you to the Ag Society for allowing us that opportunity. Our facility just is not large enough parking and space inside to keep everyone at a safe distance. The also tricky part of the challenge with the vaccination is that they have to wait because it's a brand new vaccine. We're not sure. We just don't want to have anybody walk out and have some sort of reaction. So we require you to wait. We prefer you to wait 15 minutes. If you have any type of anaphylactic allergy in the past, we ask you to wait 30 minutes with us just so you can be monitored. So that creates another challenge with our normal planned site. We do have a drive-through plan as well. We'll probably be moving towards that at some point just due to the increase in quantity that we're getting with the vaccine.
I know that you talked about the vaccine and the Ag Society helping out with the building and so forth. I don't want to say you're surprised, but have you been very encouraged by the response by the general public overall and the cooperation, people trying to partner with you guys to make this successful as we can?
Partner-wise, I have always said that Fayette County is the best place to work in. I go to other health commissioner meetings or other regional meetings, and the struggle that these health departments have to get their communities and their county partners on board is pretty astounding. I've never had that problem. From day one when all of this started, our entire county agency partner, our EMA, our sheriff's office, our police departments, our commissioners, our city managers, all of those folks, we all came together right away. And we said, we're going to be a team and we're going to partner on this. So they've always been kind of in the back, corner with us, helping us out, providing things that we need. They're volunteering in our clinics. It's been outstanding. And I will say, like, 90% of the community has been super supportive. Of course, there's those few that have been negative and critical, and that's been hard for our staff because we've been working pretty much in crisis mode 24/7 for 12 months. So we're not perfect. We know that. We know that we make mistakes. We know the state makes mistakes. We know the nation makes mistakes. So just sometimes those voices are louder, and we try to kind of put those in the back of our mind. But overall, just about every clinic we've had, some community member or partner has provided lunch for our staff. We receive cards upon cards. We receive candy to the office. We receive cookies. We don't expect any of that, but just knowing that people out there are taking care of us just means the absolute world to us. So thank you to those folks that support us, even if you're not sending things. The prayers that you provide and the messages that you send me, we really do appreciate it.
I don't want to end on a down note, but there are some things here that we are well aware of. It's taken a lot of our citizens. I mean, our Church of Heritage, we lost 2 people within a very short span of time. We've had a lot of people in this community that have passed on because of the COVID situation. Do you have any kind of an idea of how many people we unfortunately may have lost, how many have been affected by it? Or
the state is kind of doing a little different in their reporting of deaths, but as the last data report that I have, we've had 47 Fayette Countyans pass away from COVID-19.
Wow.
So that, that's another thing that's really hard for the staff. Several of those folks we've been very close to. Mm-hmm. So we've been unable to kind of stop and grieve our loved ones and our friends that we used to work with and be close to. And that's been very difficult for them. So they do deeply feel this pandemic, and each loss that we've had has been pretty devastating for our nursing staff and our COVID team in general.
I know a lot of people are saying, okay, we've got the vaccine, let's just go out and run around like chickens with their heads chopped off. We're okay. Not quite yet, right?
Right. Please don't do that. So there's this thing called herd immunity, and herd immunity is when preferably 75+% of your population has been immunized or has maybe had COVID and has some sort of antibody built up against it to where the spread and the infection is a lot less likely to occur. Right now in Fayette County, I have my little notes here because I want to make sure I get my numbers right. Okay. We have completed over 4,000 vaccines for second doses. So that's completely completed vaccination series. That's about 15% of our population. Now this is for Fayette County, not just the health department. And we have started about 6,440 first doses, and that would include the Johnson & Johnson or the Janssen brand that's known out in the community for just 1 dose. And that's 23% of our population. So I did want to mention though that our 80 and up group, 75% of our population has started the COVID vaccination series. So we are a very highly populated 65 and up county. So to me, that is excellent that we have that kind of response for our older group, 80 and up. So we have a long way to go at, 15% completed the vaccination series to get to 75. So I know everyone's excited. I know we turned to orange, and I will tell you that throughout the major holidays is when our huge case spikes increased. So each holiday, we have Easter coming up this weekend. So, if you're fully vaccinated and you are starting to go around your family again, just still use your caution. And if you're not feeling well, please continue to not go around your loved ones and your family members. It's not a free-for-all. We could easily go back into a 4th wave, turn this around backwards and head back down the rabbit hole that we don't want to be in. So we just ask you to keep being diligent. The vaccine is our ticket out of this, but we really need everyone to just continue to follow the protocols set forth by the Ohio Department of Health and the governor's office, as well as your local health department. We really do want to get to yellow, and we can't do that if everyone just thinks, oh, I'm fine. And I admit myself, now that I'm fully vaccinated, that it's been a challenge to keep in the back of my mind that we still have to be diligent, we still have to be careful. Even though I'm a lot less fearful, I still have to remind myself. So It's something we all have to continue to do, and I know that we can do it. We just got to get to yellow and then keep vaccinating, and eventually we'll be on the other side of this.
Finally, with a lot of work going on with the vaccinations and stuff like that, how's that affected you as far as service to the public? I mean, I know that's got to be one of your main concentrations, but how else has it affected you guys at the health department?
Unfortunately, a lot of our programs, I won't say have stopped, but there's been days where we've had to completely close the office. In the very beginning, we were closed because it was literally all hands on deck responding and planning. We are still offering all of our, main services like birth and death certificates, our environmental services. Some days we are closed to the public, but we are normally always available to answer questions. We've received a lot more grant programs, so managing grants. All of those things are still going on in the background. They just may not be as intense as we had hoped. We're still doing our reproductive health and wellness program. We're obviously still doing our medically assisted treatment program. Help Me Grow has done this amazing virtual Zoom calls with their families. So they may not be physically with their families, but they are virtually have access to them every day, which is pretty amazing how creative everyone has been. Our WIC program is doing something similar, so we're unable to service clients in the office as frequently as we were, but we're still reaching out to these families. We're just doing things in a distant manner, and it's just very different for us. So there are some days where things are not running as smoothly as we would like, but that's given the circumstances of dealing with a pandemic.
I'd like to remind folks that the health department does have a Facebook page, has a website, or you could call them if you have some questions. Maybe run down that information for folks.
Yep, our website is FAYCOHD.org, and that is updated pretty much daily. So all of your links for vaccination clinics for the entire county are out there. All of your stats for case counts and numbers and different things provided by the state is on there. And our Facebook page is Fayette County Public Health, and then it says Ohio in parentheses because we get a lot of Fayette County, Georgia, and Fayette County, Kentucky folks sending us messages. You can call us. The number is 740-335-5910. I will say our call volume is about quadrupled. So if you don't get through right away, we are working on our phone system as we speak. So hopefully those things open up, and you should be able to reach us through one of those outlets.
All right. Anything else that you want to talk about, or is that we've covered about everything?
I just really appreciate the community's support throughout this last year. It's been the hardest that we've ever had to work or deal with. We always kind of thought maybe something like this would happen, but you just never really think it's going to. So we do appreciate everyone's support, and we just ask that you just keep hanging in there with us so we can have some sort of normal here soon.
Yeah. Whatever that is. It's been so
Whatever
long.
it is, we'll take it.
Yeah, it's been so long, I think we all forgot what normal is anymore. Well, we want to thank Leigh Cannon from the Fayette County Public Health Department. Joining us here today on Fayette FYI. Don't forget, this program can be viewed on demand at any time on our WCHC TV Facebook page, and also airs 3 times daily on channel 1021. I'm Randy Young. Thank you for joining us.